And if he's tired and if he's not answering questions like he should, we have a great reason because he hasn't slept in about 4 weeks. But I want to thank him because he has dedicated, he is a dedicated person long before this, but the job he's done has been fantastic. So I want to thank Mike, all the people on the task force, and FEMA, and Army Corps, everybody. You've been fantastic. Thank you all very much.
Thank you, Mr. President. Mr. President.
Thank you. Thank you.
Well, good evening, everyone, and thank you, Mr. President. White House Coronavirus Task Force met today. We continue at the President's direction to focus on slowing the spread of the coronavirus through mitigation, expanded testing, and ensuring that our healthcare workers have the supplies that they need. With cases now in all 50 states and more than 50% of cases in the New York area, it's more important than ever to adhere to the guidance of state and local authorities. And for every American, the best thing that you can do, young or old, is put into practice the President's coronavirus guidelines for America. It is the way that each of us can do our part. Since we last spoke, as you all know, the President signed the Coronavirus Aid, Relief and Economic Security Act. This makes direct payments available to American families. The average family of 4 will receive a direct payment of some $3,400. It also covers payroll for small businesses across the country for a period of several months, so that even if the business is closed, they can continue to have a loan which will be completely forgiven if they keep their whole team on the payroll. There's support for critical industries, for hospitals, and for states as well. As of this evening, the President has issued 12 major disaster declarations, most recently for the states of Maryland and Missouri. And on the subject of vaccines, Emory University in Atlanta today began enrolling volunteers in a phase 1 clinical trial of another possible vaccine for the coronavirus. On the subject of testing, testing is available in all 50 states, and as a great credit to our partnership with commercial laboratories across the country, this morning it was reported that more than 685,000 tests have already been performed, and we are particularly grateful to the American Hospital Association, whose members are now reporting into the CDC and FEMA in real time, giving our experts more visibility on those that have contracted the disease around the country. The President mentioned this, but it's worth mentioning again. Apple has a new app out. It is a screening tool that will help Americans determine whether they should be tested. It has a easy format, question and answer. If you have issues about whether or not a test is appropriate for you, you can use the new Apple app to accomplish that as well. On the subject of supplies, the President spoke about the priority that we're placing on personal protective equipment and especially ventilators, and I will not add to that. I can tell you that this weekend we'll be reporting on aggressive efforts that our supplies stabilization task force at FEMA is taking to import medical supplies from around the world. We're working as we speak on an airlift from a number of countries around the globe to deliver very important medical protective equipment to the United States. At the present moment, you've heard the numbers, but from the Strategic National Stockpile, we distributed more than 7 million N95 respirators or masks, more than almost 3 million face shields, more than 8,000 ventilators, and donations to the Strategic National Supply. We've mentioned Apple donating some 9 million masks that can be used by healthcare workers, but Merck recently announced plans to donate 500,000 masks, USPS 500,000 masks, and a little company called Puritan in Maine is actually in the business now of manufacturing swabs. So businesses large and small all across America are rising to the challenge. As the President noted, he will attend the embarkation of the U.S. Navy ship Comfort tomorrow from Norfolk. The U.S. Navy ship Mercy arrived in Los Angeles today. We will continue to focus resources and supplies on those areas around the country that have seen significant outbreak. But let me send a word to hospital workers around the country. We continue to hear anecdotally and occasionally see in media reports people who have concerns that their hospital may be running short on personal protective equipment in the days ahead. We just encourage you to alert your hospital administrator. Hospital administrators, please alert your state health director. Tonight, Administrator Gaynor at FEMA will be speaking to all of the state emergency directors in America to talk about the availability of resources, but also encouraging them to have a plan to perhaps even use their National Guard to move medical equipment from storehouses to hospitals. We'll be working very closely with state emergency managers on issues of logistics. But today, we're fortunate to be joined by two members of the cabinet who have been very busy making sure that the children of America have the meals that they need while school has been suspended in so many places around the country. Secretary DeVos and Secretary Perdue are going to share some exciting news and progress that we've made in feeding children who need nutrition assistance while schools are closed. The truth is many underprivileged kids would not be getting school meals apart from the fact that as we stand here today, our administration has approved waivers for all 50 states to give them flexibilities to work with local partners to get meals to children that are in need, and also a nationwide waiver to allow parents to pick up meals. But what's most exciting today, as our two cabinet secretaries will reflect, we have private sector partners, a few of whom are with us today, who are helping us speed important meals to children and to families around the country. You'll hear in a few moments from the chairman of McLean Global Logistics and also the CEO of Panera Bread about the work that they are both doing to literally deliver millions of meals to American families. It's truly an inspiring story, and I look forward to hearing it from them and sharing it with you. But it's just one more example, as President Trump said, that we'll get through this, and we'll get through this together. Not only a whole of federal government approach, working with all of our state partners, working with healthcare authorities at the local level, but also working with businesses that have been willing to step up and stand at the point of the need and be there for the most vulnerable and help us meet the needs of our children and of our families. And on behalf of the President and a grateful nation, we thank you. Madam Secretary.
Thank you so much, Mr. Vice President. And I just want to begin by thanking President Trump for his clear-eyed leadership during these challenging times for our country and for our world. And Vice President Pence, for your tremendous leadership of the task force and for truly making a difference that's certainly true for America's students and teachers as well. Most of them, as Owen said a moment ago, experiencing unprecedented disruptions in learning and in their lives. I want each of them to know that President Trump and his administration are taking decisive action to keep them safe and healthy so they can continue learning. We must rise to the challenge of educating all children from all walks of life who all of a sudden are in many, many different learning environments, and they're counting on all of us to find solutions. I'm really pleased to be here today for the announcement of another terrific solution initiated under the President's leadership. Secretary Perdue is going to share details of this public-private partnership, but before that, I'd like to provide a few additional comments and talk about the work that the Department of Education has been doing on behalf of students, parents, and teachers during this national emergency. My team and I are in contact daily with governors, state school chiefs, college presidents, superintendents, and local education leaders. We are quickly responding to their needs so they can do the next right thing for their students. Most governors have decided to close some or all schools in their states for a period of time. As a result, students may not be able to take federally mandated standardized tests this spring. And the President took action to make sure they didn't have to. We made the process to delay these tests for a year fast and painless. As of today, 47 states have requested the delay or the waiver, and 46 have been approved within a 24-hour period. We also released additional information making clear the expectation that education will continue for all students. The transition to distance and online learning needs to happen quickly, and it needs to include meaningful instruction and supports for children with disabilities. Learning should not stop or be denied because schools fear federal regulators or fear doing something different. Distance learning is happening. States like New Hampshire and Florida have implemented phased and tiered approaches to meet the needs of students in their states. Other schools and states are implementing creative approaches and working through practical realities to help students continue learning. In remote Colorado mountain towns without internet connectivity, teachers are putting weekly learning packets together, and they're holding office hours by phone to help their students when they're stuck. South Carolina is deploying 3,000 buses with mobile Wi-Fi hotspots to help kids in remote areas access learning that way. This national emergency gives all of us an opportunity to come together to educate all students out of principle. It's simply not an acceptable option to educate none of them out of fear. So we stand ready to assist educators and their students. We're compiling all of the tools we have produced, along with the great resources that states are offering to help keep learning going. There are already many existing online learning platforms, and many states were already offering a robust menu of courses virtually. We will be adding that information to our website on an ongoing basis, and that site is ed.gov/coronavirus. We're using every tool possible to extend flexibility to states and communities. This includes funding flexibility. Where we don't have the latitude, we're working with Congress on solutions. One area is providing direct financial support to students, families, and teachers. We will propose Congress provide microgrants to help students continue to learn. These would be focused toward the most disadvantaged students in our states or communities where their school system has simply shut down. I've always believed education funding should be tied to students, not systems, and that necessity has never been more evident. We'll also support microgrants to teachers to help them pivot to supporting all of their students in a different environment than they've been used to. We know they are dealing with an unprecedented situation, but it's been truly inspiring to hear story after story of teachers rising to the occasion and meeting the unique needs of each of their students. Ultimately, we know everyone's grappling with the challenge of keeping students safe and healthy while also building capacity for remote learning. It's an important moment to realize that learning can and does happen anywhere and everywhere. I think of the Texas dad who started a daily webinar interviewing friends and acquaintances in wildly different careers and helping students understand what it takes to work in that chosen career. Or the history teacher in Virginia who connects with his students through a live stream every morning. I think of the art teacher in Tennessee who's broadcasting her lessons over social media, or of Second Lady Karen Pence, who prepares packages of art materials and projects for her students to pick up with their school lunches. Or the principal in Alabama, who's going online daily, giving morning announcements, leading the Pledge of Allegiance, and a moment of silence. And I think of the many schools that have distributed laptops and tablets to students who don't have them so they can continue learning over video conference, and the ones that just don't have that option currently, like the remote Colorado towns. Joy Hoffmeister, the school chief in Oklahoma, may have put this best. She told me, "School isn't a building. It's students, teachers, and families working together to advance learning." She's right, and that's our shared mission. Let me also touch very briefly on how we're supporting students pursuing higher education. At the beginning of this outbreak, we immediately gave institutions of higher education regulatory flexibility so learning could go online, and it did. In many cases, it was a seamless transition, and learning continues. And we're continuing to cut federal bureaucracy and let schools rise to meet this challenge. We've vastly improved distance learning policies, which are working quickly to enact for traditional higher education. Shorter-term programs and apprenticeships also need to grow and thrive, and as the president has so effectively championed, workers need these options as they look to come back stronger than ever from these momentary setbacks. The president promised to defeat this invisible enemy and keep our economy strong. He took immediate action and provided student loan relief to tens of millions of borrowers. We set all federally held student loans to 0% interest rates and deferred payments for 60 days. Now, with the CARES Act that he signed just earlier today, Mr. President, those actions will extend to 6 months. We hope these actions and others we've taken for those who've become delinquent on payments or have had other issues with their student loan payments will help alleviate the financial burden and anxiety students and their families are feeling during these tough times. These are tough times, but we, the people, are tougher. So in closing, let me offer just a few words of encouragement. To our students, your educations can and should continue. Learning can happen anywhere, and we will help make sure it does. We believe in you. To our teachers, we will support you and help you. You are doing great work. Keep it up. And to every parent and family, we know these are challenging times, but it's in the face of great challenges that Americans have always risen to the occasion and embraced greatness. And I know we'll do that once again. I thank again the President and the Vice President for their leadership on behalf of America's students and on behalf of all of us. And now I'll turn to my friend Secretary Sonny Perdue to share more on how we're working together to help support student nutrition.
Thank you very much, Mr. Vice President. While our dedicated educators are out there trying to continue to fill our kids with knowledge even when they're not in a school site, USDA is working very hard to continue to fill their tummies. You may know that many of these children receive breakfast and lunch at their school sites, and our federal government participates with our dedicated school nutritional and lunch professionals throughout the country, and we have issued waiver after waiver to make this flexibilities available for things that make sense when children cannot congregate in a singular location. That's one of the first waivers we issued, and when Congress gave us the authority to issue more, we are turning those waivers around in rapid speed, really less than 24 hours. So we're very fortunate that we've got a great team at our Food, Nutrition, Consumer Services team working 24/7 to make sure that our kids continue to be fed. It's a great partnership that's happening out there. I want to mention one other simple but very important point about another matter that your listeners and readers may be very interested in. That's the food supply chain. USDA obviously is intimately involved in the food supply chain. We've worked with all those producers, even the ones who provide equipment and materials for our farmers and cattlemen and producers out there to make sure they have what they need. They're part of the critical and essential workforce there to continue. And the good news is those folks are staying on the job. Those who've grown it, those who are processing it, our inspectors who are grading it just the same way they always had, those folks who are delivering it, packing it, delivering it, stocking those shelves, and checking out those customers. That's the great news about our food supply chain. And it's a great American story. Mr. Vice President, under your leadership, the President's leadership, this is that whole of America approach. Federal government can't do it all, but we got great partners out there in the food supply chain, as well as our food nutrition services and our partners in our school nutrition services doing a great job to continue to get these meals to kids there. Two of our private sector partners are here with us today. I'd like for them to tell their story because it's a great story. Denton McLean with McLean Global here has partnered with Baylor Collaborative on Poverty and Hunger, along with PepsiCo, in order to pack 1 million meals a week to deliver to rural kids who might not can get to town to these drop-off sites where the other kids are picking up meals. And again, Niran Chaudhry of Panera Bread, CEO of Panera Bread. Their company is also participating in Columbus, Ohio, with the Children Hunger Alliance there to deliver food meals that meet the regulations of USDA under flexible conditions there, to get food meals there. And Panera's looking to expand that to nationwide as well. So, Denton, why don't you come and tell us your story? Thank you very much.
Thank you. Mr. President, Mr. Vice President, Secretary Perdue, and Secretary Voss. Right now, there's a lot of focus on our large cities and the enormous challenges that they face. But imagine this. You live in Iberia Parish, Louisiana, or you live in the Nome Borough in Alaska. Your schools are closed, and normally your children get 2 meals a day at school. Both parents are working from home, but mom and dad just can't get to town where meals are being offered for pickup. That's about to change, and change for the better. Because of this USDA program, McLean Global will source, secure, receive, organize, assemble, package, label, and then deliver boxes straight to a child's home. And here's another big difference. For the first time, we'll be able to offer shelf-stable meals that will last 2 weeks. That's a true game changer for rural families. It's happening because of the president's order to do whatever it takes to get the job done. Everyone knows that tons of paperwork can be like lighter fluid for a great idea, and this is a great idea. We field tested it in 2019, and it worked. You've heard today about the administration's work on this project. Here are some other important partners in this effort. We have Baylor University. They will provide sponsorship and oversight. In addition, we are deeply appreciative to UPS and the United States Postal Service, and we are joined by PepsiCo Company to help get this accomplished. Because of this collaboration and our tireless employees, I can report to you the boxes are ready to ship. And after all, this is all about the children who must be fed during this crisis. We stand ready to serve. Thank you, Mr. President and Mr. Vice President, for caring about the specific needs for the children who live in rural America. Thank you.
I want to welcome Niran Chaudhry, CEO Panera Bread.
Good evening. Thank you, Mr. President and Mr. Vice President, for your leadership. It's an honor to be here, and I'm deeply grateful for the opportunity. This is an extraordinary time, and I passionately believe that at such times we must all come together and do our very, very best to contribute and make a difference. At Panera, our mission is simple. It is about ensuring that good food is accessible to everyone, especially those who are the most vulnerable, such as children, and especially at a time like this. And we are absolutely determined to make a difference in this regard. Today, we are announcing a partnership with USDA and Children's Hunger Alliance to serve freshly prepared, wholesome meals to children in the entire state of Ohio to begin with, and hopefully after that to expand that program across many other states in the country. I do believe that the human experience, indeed life, is all about having resilience in the face of adversity and also having the tenacity to just keep going, And at Panera, our associates and our franchise partners live that spirit every single day. They are resilient and they're tenacious. And on their behalf, I pledge that we are committed to do the right thing for the country and help serve those who need it the most at this very important time. We are ready to serve. Thank you very much.
Outstanding. Thank you so much. Thank you so much. Thank you for your business's incredible generosity. And I'll actually allow the two business leaders to step out if you'd like. We appreciate you so very much on behalf of the President and a grateful nation. Before we go to questions, I'm going to invite Dr. Birx and Dr. Fauci to step forward with a few reflections on what we're seeing in the data. And as you all are aware, over the next several days, our team will be assembling recommendations for the President to give further guidance to the American people, to states around the country, and they can both share with you the importance of ongoing efforts of mitigation by every American, the need to support what state and local leaders guidance is to every American community, but also as Dr. Birx continues to work carefully with the modeling, analyzing the data, she'll reflect on the progress we've been made in that. Deborah?
Great. Thank you, Mr. Vice President. Just to pick up on some of the questions that you had earlier. So the issues that we discussed with the modeling yesterday was to ensure that the models were adjusted for the great work that every citizen is making in doing the mitigation efforts, and to see if that was reflected in the request specifically for ventilators. And so we wanted to make sure that with a limited number of ventilators and the issues that we saw in Detroit and Dearborn, in Cook County, and now in New Orleans, that we were balancing and projecting correctly based on both what the models had predicted and then whether they were adjusted for the incredible mitigation work ongoing in New York City. We understand that this week and next week will not reflect that mitigation, whether it's New Orleans or whether it's New York and the New York metro area. We know that the hospital admissions that we are seeing this week and next week will be infections that occurred before the mitigation started. But we wanted to make sure going forward that the needs reflected that. That was what was adjusted in the Ferguson model for the UK, and I know you're following that very carefully. They believe strongly that the mitigation methods that were put into place that informed our mitigation methods, we all were working off of that same model, and I want to make it clear that those models, those flu models, have been incredibly helpful to really predict what would layering of these different mitigation methods, from social distancing to staying home if you're sick, to staying in that household, to quarantine everybody in the household if anyone is positive. Now, there are other countries that took different approaches, and I want to be clear because we did hear from both China and South Korea. But it's always important that you adopt and adapt it to your community and the reality of your country. We do this around the world. You can't ever just take an off-the-shelf approach and then put it into action in your community. You have to understand your communities. And so although both China and South Korea removed people who were positive from their households and segregated them away from their families, we did not think that our Americans would adopt and adapt to that situation. And so that's why in our guidelines we asked people, if there is a family member, to try to self-isolate in the household, and so that that person is still there in the household. So I just wanted to be clear that, yes, we all heard about what China and South Korea did as much as we could. We adapted them to the American situation, as the UK has done also. And we just wanted to be really ensured that all of the requests for the stockpile reflected the great work that the American citizens were doing in each of these areas to ensure health. And then finally, I know there was a question about requiring quarantine. I want to make sure that everyone understood when we talked about New York residents who had gone to other places, it was for them to voluntarily self-isolate and take care of themselves because we felt like they could be exposed. And we really wanted to alert them that the rates in New York City were high and were increasing, and that they were probably exposed during some of the most exposure time period before the mitigation efforts went in. So this was really about a health of our New York citizens that then chose to go to other places, both to protect themselves and to protect others. So hopefully that's clear to everyone about those issues. We continue to look at the data every day. We really want to applaud the laboratory testing that is helping us. It will help us very much when we can get full surveillance up in many of our communities and surveillance around those most vulnerable, particularly in nursing homes and long-term care facilities, so that we can more rapidly test both the workers and the occupants in those communities. Thank you.
Yeah, thank you very much, Mr. Vice President. Today, just a few hours ago, I had the opportunity to get on a telephone call with the people who are on the front lines, the people who are actually in the ICUs or in the hospitals from all of the areas that are being hardly hit, including New York. And I'm not a supply person. I'm a physician, a scientist, and I do vaccines and I do drugs, but I am a member of the task force, and I do take very seriously the responsibility that we have to those individuals to get them
the material that they need. We've heard discussions about this, ventilators, personal protective equipment, masks, and things like that. They are doing an amazing job up there. And I just want to have a message to them, which I told them over the phone, that as a member of the task force with my colleagues here, we're going to do everything we can to make sure that they get everything they need at the time that they need that, because they are doing an amazing job up there, and I salute them. Thank you.
Great. We'll take a few questions.
Just a quick one to Dr. Burks.
Yes, please.
I asked you, I think it was about 8 or 9 days ago, about the data from all these tests, and you had suggested that there would soon be a website where we would see all the data. Are we closer to that? When do you expect that? Do you have any data to give us tonight? 'Cause as far as I can tell, this has not been publicly released yet.
Yeah, no, thank you. I've learned as Tony has described, we've learned that when a community is educated, we all do better together. And so it's important to get that information out when we start talking about where the virus is, what the percent positives are, and really inform communities so that they can make decisions, so that people can take protective measures for themselves and for their families. And I find that it's important, yes, for us to have the data, but it's equally important for the state and local governments as well as the communities. We are still, because we worked very hard to get it into the first bill, but it was changed to state and local labs, and obviously 95% of all the tests are being done in the commercial labs. So in this recent bill that was just approved, it is mandated that all commercial labs need to report. And so you'll have that data when we get the data comprehensively from all the commercial labs. Well, it was passed today, so hopefully we'll expect it tomorrow.
Guys, only one more question.
Dr. Fauci? About the guidelines, if I can, Dr. Burks or Dr. Fauci, whomever, I guess what is the testing standard here? Are you going to need to test people who are well or only people who are symptomatic? Obviously, let's say in an Omaha, 10 people walk into a hospital, 5 come in, they're all tested positive, 5 go home, they may still be positive. What is your standard in order to make these recommendations?
So I'm glad you asked, because the important thing about testing, it only tells you if you're positive or negative that day. You could become positive the next day. And so testing should be used intentionally as a surveillance tool or a diagnostic tool. And I think what we're going to work on over the weekend is to weave together both a testing strategy for surveillance, which you have brought up in that key point, while maintaining a strong testing for diagnosis, because our first obligation is still to ensure that patients get diagnosed, both so that the personal protective equipment for those who are negative doesn't have to be utilized, but also to give those patients the opportunity to have optimal care. And I think Dr. Fauci mentioned this a few minutes ago. The things we have learned over the last just 3 months was a lot of information about how best to ventilate patients. I think that has been shared across communities and across clinicians around the globe. We never previously had an experience where a lot of people had to be ventilated prone. So this kind of information that has been shared has been critical to improve the survival of the patients that we have in the United States of America. And we really want to applaud the countries who've been giving all of us that information and sharing it across the clinical network.
One quick one to Dr. Fauci, if I could. Dr. Fauci, Sunday will mark 1 month since the first death from this new disease. I wanted to ask you a bit of a philosophical question. I've known you for 25 years. You've been through HIV, AIDS, MERS, SARS, West Nile virus, Ebola, all of that. How has this nation changed since that first death 1 month ago?
Well, this is truly an unprecedented situation that we're going through. As you mentioned correctly, John, I have been through everything from the very beginning of the very uncertain days with HIV/AIDS. Cumulatively, if you look at what's happened with HIV/AIDS over the 38 years that we've had it, the burden and the suffering and the death has been enormous, historic. But it came over a period of time. There was the fright in the beginning. What we're seeing now in actual real time is something that's unprecedented. This is something that we have never seen before, at least in our generation. They've seen something maybe like this back 100 years ago. And we're really being challenged to not only learn in real time, to be able to respond in a way that is helpful and effective, but we're also in uncharted waters. And I think that's the thing that I find different, is that the waters are uncharted so that it isn't as if we have an example of how to do it. We have an extraordinary confrontation on the health and the welfare of the globe, particularly, for us here in the United States. So as somebody who's been through all of those outbreaks, this truly is unprecedented. So from the first day to now, the first death, we've been through something that no one has ever experienced in our generation.
Let me say good evening to each one of you. I trust this was helpful. We'll continue to keep you informed. Over the course of the weekend, the President will be traveling to Norfolk for the embarkation of the U.S. Navy ship Comfort. Our task force will be meeting through the course of the weekend, and we'll be reviewing the data and preparing recommendations for the American people going forward. But thank you all for your time and attention.
It was thorough.
Secretary Perdue?